Hello, hi. This is Pankaj, and she is my mother-in-law. So, actually, she met with a car accident, and in that accident, that is a fatal accident. So, in that accident, she her spinal cord got broken. So there were L1, L2, and L4 fractures in the spinal cord. So, she is in deep troubles.
This 65-year-old lady came to my OPD with a history of road traffic accident. It happened about 2 weeks prior to visit to my OPD. She was in a stretcher. Hardly there was movement of the both lower limbs, and she was on Foley's catheter due to severe bladder dysfunction. Prior to visit my OPD, they visited 2 other hospitals. She was managed conservatively.
And after that accident, she is unable to sit or walk. She is completely bedridden. So then after we visited Kailash Hospital and consulted Dr. Debabrata Mukherjee. So we got to know about Debabrata Mukherjee from some of our knowns. So they suggested us to consult Dr. Debabrata Mukherjee. Then we got here to consult him.
She came with an MRI and X-ray that revealed L1, L2 fracture. And L1 actually is the center that controls bladder movement and also movement of the lower limbs. So she was not in very good shape. I advised surgery for her.
So after he examined the details of the injuries of her and done some tests like MRI, CT scan on all those things. So he suggested for some surgery.
Although they are from a very nice family, very good people, next the question were asked to me whether she will improve after surgery, any complication will come, how major is the surgery, and whatever minimal leg movement is there, whether due to complication, whether it will deteriorate further or not. Very difficult questions, not easy to answer. However, looking at the compression, I advised surgery and I explained everything to them that surgery should help.
And then we definitely go by that surgery as per his suggestions. So that is a complex surgery.
Probably they were not well convinced, so they left my OPD. Again, they visited me after 2-3 weeks. I again explained surgery should help her. I explained also that there is a possibility of movement of the limbs. We should take a chance. Again, the question of improvement, complications were raised. However, after a month or so, they wanted a repeat MRI. Repeat MRI revealed the same findings. Also, there was hardly any improvement of the patient, not in terms of movement of the lower limbs,
which is related to the nerves, and those nerves are connected to these foot movement and all those things, even the urinary bladder also. So these kind of nerves being controlling those areas. So this is a kind of very complex and difficult surgery.
Also, 1.5 months after the accident, there was barely any movement of the lower limbs. MRC grading was just 2/5. That means some movement of the legs when gravity was eliminated, and she was still on Foley's catheter with no bladder sensation.
But we have faith in Dr. Mukherjee, and as we have got some good reviews from our knowns, who have asked us to consult him. So we have gone by that surgery from him. So finally, you are seeing right now her in good position.
However, at the end, they were ready for surgery. She was taken up for surgery. Decompression of the pressure was taken away, and the spine was also fixed with the implants so that she could be mobilized early. After surgery, she was mobilized on the first post-operative day, and on third post-operative day, when I visited her, to my surprise, I could see she was walking, of course with some support, but she could walk. So this is a miracle for them. Everybody was so happy, and it was an unexpected result for them. And she also started having bladder sensation also.
So surgery got completed on Tuesday of this week, and it's like hardly 3-4 days of the surgery, and she is able to walk with the help of walker, of course, and with the help of some little bit of support of some couple of persons, but she is able to walk within this ward, and there is a significant improvement in terms of the recovery, which we are not expecting, because it's kind of a miracle, and all that has been happened due to the sheer knowledge and expertise of Dr. Debabrata Mukherjee. So there is like many thanks to him and the hospital for like doing this perfect surgery and making her like to back to a normal life.
Subscribe now and press the bell icon. Never miss an update.